This is Winona from Mailloux Dentistry, and I was just going to give you a quick little tutorial on how to use your new Sonicare toothbrush. So the model that I have today is the Easy Clean. So we kind of call it the basic model here at the office. This is the one that I use at home. So the heads come off, they just pull off like that. There's different brush heads. This is a standard. There's also compact, which is smaller. The great thing about the Sonicare is, and with all electric toothbrushes, is that they have a 2-minute timer, so that's going to help you brush longer. So from the minute you hit this button, it's going to go for 2 minutes, and we don't want you to stop brushing until the brush stops for you. So the few things that we want to do a little bit differently rather than manual brushing is kind of toothbrush placement. So once you put your toothpaste on, you can wet it if you like. And then you're going to set the toothbrush right at the kind of gum line. So basically where the tooth and the gum come together. And so when you're kind of regular brushing, we've probably gotten the habit of kind of this back and forth motion. So we don't have to do that with the Sonicare. It's actually easier. It takes a little bit, maybe some time to get used to it, just because it's a new habit and it forces you to slow down. So you're going to set, so like I said, you put your toothpaste on, you're going to set it on the gum line, and then here's a very important tip. You want to make sure that you close your mouth over the brush, because if you turn it on outside of your mouth, this little spray, it's going to be all over your mirror, and then you'll have a little mess to clean up after you brush. So just let's keep it tidy, and then you want to close your mouth over the brush and then turn it on. So I'm going to turn it on. I don't know if you'll be able to hear it or see. So I'm going to turn it on. So those bristles kind of like oscillate or pulse very, very quickly, and so you're going to set it right down at the gum line, and then every 30 seconds the brush is going to stop and then start again really quickly, kind of pulse. So that's signaling for you to move to the next area of the mouth. So you're going to do, let's say, your lower right first. It's going to pulse, and then you're going to go to your lower left. And kind of a little area too that can be tricky. It just pulsed there. I don't know if you could tell. So the lower front teeth is where people get a lot of buildup. So I would say if you can almost, it's like you're going to have the toothbrush almost kind of vertical, kind of coming out of your mouth rather than kind of straight like this. So you might just kind of have to angle a little bit different. And then, so you're going to do your 30 seconds all over. I'll just kind of focus on this side just so you can see a little bit better. So you'll do 30 seconds here, 30 seconds on the other side of the lower, and then your 30 seconds on the top. Okie doke. And it's probably going to maybe tickle a little bit. That's one of the comments that we get from our patients. But the brush, when you first get it, even like the first, I think it's 14 times that you use it, the brush kind of slowly increases the intensity. So it starts lower and then works its way up so that you can kind of get used to it. We love the Sonicare toothbrush. It's great for patients that have a little bit more buildup, so it helps kind of keep things cleaner in between their cleanings. Patients that have gum disease, deeper pockets, patients that come more frequently, every 3 to 4 months, it just really helps the gum tissue. It increases like good healthy blood flow, circulation to the gum tissue, and the tissue actually like firms up. It gets pinker, tighter. Kelly, Dr. Mailloux, when we look at your gums after switching to a Sonicare toothbrush, we can really tell the difference. It does a fantastic job. Also, for patients that may struggle with flossing, it really helps kind of pick up the slack, so to speak. It doesn't replace flossing, unfortunately, but it really does a kind of gets in between there with kind of the micro bubbles and that dynamic technology that the Sonic toothbrush has. So I would say for brush heads, Sonicare says replace every 3 months. We say at the office you could probably do every 3 to 6 months to kind of get you by a little bit longer. But once you put that fresh brush head on, you'll be able to tell the difference. So that is basically the Sonicare toothbrush. If you have any questions, feel free to give the office a call. Have a great day, and thanks for watching. Keep smiling.